you so much for joining us today for our No Stupid Questions podcast. I'm Dr. Kim Bissell, the Southern Progress Endowed Professor in Magazine Journalism and the Associate Dean for Research in the College of Communication and Information Sciences, or CNIS, at the University of Alabama.
And I'm Dr. Annalisa Bowen, an Assistant Professor in the Department of Communication Studies, also at the University of Alabama. And we both work in the Institute for Communication and Information Research, or the ICIR, at UA. So, Kim, did you know that 6 feet apart is the size of an entire elephant?
I did not know that.
Wait, maybe it's a baby elephant? Or maybe it's that 6 feet is the exact size of a gator's snout or mouth. I don't even know what they have going on in their body. And that might be, I don't know, maybe that's not right at all. But I did see, I think on social media, that UA's fight song, if you sing that 3 times while you're washing your hands, that's the right amount.
Wow, that would be a long time washing your hands.
Well, maybe it's only 1 time. I mean, how do we know what to believe or not to believe when it comes to how we manage what we're supposed to do to keep ourselves healthy and safe during the pandemic, especially when it contradicts something else we've heard?
That is so true. And over the last several months, we've heard so much about COVID-19, this pandemic that we're all trying to deal with. And the information has certainly been conflicting or contradictory. It's almost hard to know what to believe when we hear so much from so many different sources, and we're trying to navigate who's credible, who's trustworthy, and who's not. So, how do we sort through all this information to find the truth? And what do we do with conflicting information, especially when it comes to whether we should wear a mask or not, or whether to stay 6 feet apart or not?
Excellent questions. And our next guest is going to break all of that down for us. Dr. Ji-Yeon Lee is an assistant professor in the Department of Journalism and Creative Media, and much of her work relates to health misinformation and how we as consumers can learn how to sort through what might be the truth and what might not be the truth. We'd like to give a warm welcome to Dr. Ji-Yeon Lee.
Before we get into this conversation with Dr. Ji-Yeon Lee, I just wanted to make a note that we had connectivity issues throughout the recording of this podcast. In an ideal world, we're all sitting in the same room, we've got equipment, we're face-to-face having this conversation. In the real world, that's not the case at all. We are all in different locations using our phones and computers to connect. And as is almost always the case, one of us is going to have problems with our internet. So I just wanted to mention that because you do have a couple of pauses, a couple of places where one of us will go out. But this is still a great conversation. So please hang in there through our connectivity issues.
Hi everyone.
So just to get us started, you say that you study health and risk misinformation and deep fake. For our listeners who don't know what that means, can you tell us what you mean by deep fake?
Oh yes, so deepfake is kind of like newly emerging misinformation type. So it's kind of like under the umbrella of misinformation and fake news. So to give you some idea about those who don't know that much about the misinformation, so we call misinformation in theoretical perspective as the information which has been unverified as true, so and then later turn out to be as false. So deepfake in that perspective is kind of like face swapped video is the most popular example of the deepfakes, using the deep learning technology and machine learning. And nowadays, people can easily just swap like 2 different person's faces and then create, like totally fake video. And then it actually, shows that person A actually say something, but in reality, the person B actually said the thing. So it's really like kind of to produce another fake news and misinformation.
Thank you so much for that definition of that. I thought it was really important for our listeners to get a definition of deep fake. Thank you.
So kind of continuing on
absolutely.
that, how would you kind of describe how you got into your research?
Did we lose you?
Oh, I'm still here. I cannot hear you. I mean,
no.
I haven't heard anything. Yeah.
I'm sorry. Can you hear us?
I haven't heard anything after I explained the definition of deepfake. Did you guys say something?
Oh no. We did. Okay, so let's try this. Can you tell us a little bit about how you got started doing this type of research?
Yes. So, as Dr. Bissell explained a bit, I examined this misinformation, disinformation, and deepfake in the health and risk areas particularly. And what I mean, like health risk, communication is that whenever we face like health crisis, so this kind of like COVID-19 pandemic, or whenever people are facing disaster situations like terrorist attacks or any other risk-related events, they really have a high level of anxiety and fear. And I actually had a particular interest what those kind of unique situations drive people to believe like unverified information. I believe like this is really a different situation from our normal days, because people tend really care about others and really want try hard to make an objective and accurate judgment whenever they face some information. I mean, sometimes they rely on their pre-existing beliefs like political orientation, but I can say that most of the people really try hard to be media literate, but this kind of unique situation and crisis situation makes a totally different story. So that's why I really had a particular interest about like how this health crisis and other risky situations make people to believe like misinformation, and why those kind of corrective information doesn't work in this particular event.
That's really interesting. Are you able to hear me now?
Ji-young, so it sounds like I'm able to hear Annalisa, but you are not.
No, yeah.
So I'm not sure what's happening on our end, but I'm just gonna keep going with the question. So I do apologize for that.
Oh, it's fine. I actually lost Annalisa here now. I don't see her name.
I think she's trying to connect and reconnect
okay.
to improve the signal. Ji-young, if you had to come up with a headline for one of your more interesting findings, what would that headline be?
So I can say that relating the risk to myself matters in health crisis. Because one of the most interesting findings in my research is that during the health crisis situations, whenever like misinformation pops up, people tend to believe those misinformation, even though the correction really, appears. And I found that that's because people tend to relate that kind of health crisis to themselves. So whenever people experience like susceptibility in our academic terms, they tend to believe more about the misinformation. And I believe that's probably because people feel very like uncertain about the situation, and they feel that they are in danger of the situation. So I believe that how people relate the crisis to themselves really matters. So I can say that the title could be like relating the risk to myself matters.
Oh,
I think that's a great title.
Yeah.
I totally love that.
Thank you.
Really interesting.
So, Jiyoung, can you talk to us a little bit about the methods that you use for the research you do? Can you break that down a little bit?
Oh yeah, absolutely. So I can say I am a quantitative researcher, and then most of the methods that I use are online experiment and online survey. And I sometimes do a lot of offline experiment, but due to this COVID-19 situation, I mean, I am no longer to do it anymore. But I also expand my methodology these days to the computational analysis as well. For example, like social network analysis or other machine learning things, so that I can expand this misinformation arena to a more kind of broader level, which is social media ecology.
Oh.
So, when you talked about computational methods, can you explain that and break that down for our listeners?
Yeah, so there are really a lot of, I can say a lot of like different types of computation analysis, but recently I have started working on analyzing like sentiment of the tweets by downloading like a large set data set. So to just briefly explain about what I do these days is about like I examine the misinformation about the COVID-19, and then what I'm doing, other my colleagues, is that we downloaded a bunch of data set by searching the keywords related to the COVID-19 misinformation, and then we try to analyze the sentiments, in other words, emotions in there. So it's more likely about like analyzing the features of the large set of like data in the social media like Facebook and tweets. So I'm expanding my research arena into that these days.
So with the rapid pace of social media, how do you keep up?
That's a really, kind of challenging issue to me these days whenever I conduct some other research. But I really focus on, the time that misinformation first appears, or the time that WHO or CDC, like other health organizations, started to rebut those kind of misinformation. So even though the time range is really, long, and even though we tend to have a large, really a large data set in social media, I try to focus on the time that first misinformation or corrective information appears and how publics like respond to those information at that time.
So, Jiyoung, you had mentioned that you are working with some collaborators. Can you tell us a little bit about the nature of your work in terms of if you're collaborating, are you collaborating with people in our discipline? Are you working with people in other areas?
Oh, yeah,
Can you
sure.
break that
So
down a
I
little bit?
mostly collaborate with researchers in our field, communication and media studies. But I try to work with other researchers in other fields as well. For example, like some of the colleagues of mine are in social work, and some of them are in social psychology. So whenever we meet our common interest to do like other research, we collaborate a lot. But most of the colleagues that I am working nowadays in are in media and communication field.
I think it's really interesting because we obviously will have broader interests than just our fields. And I mean, given that we are academics, it kind of suggests that we're interested in knowledge and kind of expanding that knowledge. And so really research allows us to learn areas that we might not otherwise have an opportunity to get into.
Yeah, that's true. But sometimes, like I realize, especially these days, our field is really interdisciplinary, and whenever we like bring some theories from other, fields like other arena as well, there are really a lot of opportunities and chances to collaborate with field scholars in different fields. I think
Yeah.
that's a good sign. Yeah.
So, Jiyoung, one of the things that you talked about was how you are looking at all types of social media and all types of information that we're getting from that channel. Are there ways that you can say that your research is contributing to social justice or are there ways that you can kind of be diversity minded
Oh yeah,
in the research that
absolutely.
you do?
So I believe my research can contribute to social justice in terms of like helping people, especially who are not media literate or people who are suffer from the health crisis, and even people who are kind of mentally affected by this crisis situations. Um, I think the most important thing that we can recognize in this health crisis event is that a lot of people really want to get information because to reduce their uncertainty. But sometimes
Mm-hmm.
actually oftentimes they really don't know how to get accurate information, and they really don't know how to discern like accurate information from unverified information. So I really want to help those kind of people who are non-media literate, so that they can better understand how they can discern like accurate information from inaccurate information, and then how they can use like social media platforms in their own accounts in a better way to get accurate information.
Do you ever study? I just kind of thought about this, but we see information, and then particularly disinformation seems to just spread. Um, and that may be online through
Mm-hmm.
other social media, but it may be in person too. Do you ever look at how maybe you see something initially on social media that is not correct, not true, but how it spreads from person to person?
Oh, yes, that's a very interesting question. And, one of the survey that I'm currently designing about the COVID-19 considered that matters about the relationship with others. And you're right, Annalise. I mean, if you think about our everyday life, we not only get information from, a person who don't know, like strangers, but we oftentimes also get like information from our close friends or families. And I think like differentiating how, the social relationships in terms of getting information is really important, because a lot of research actually talks about that, the information that has been received from like close friends or families tend to be perceived as more accurate compared to information that is received from like other strangers. So I think that's one of the interesting area that we can look up further in terms of this information.
Yeah.
Well, I think you're raising such a great point that's very applicable to this situation we're in right now with the COVID-19 and the global pandemic. We are, getting more information from the internet and more information from social media channels. And I might have one person saying, wear a mask, wear a mask, wear a mask. And I might see another person who says, this is a hoax. You don't need to wear a mask. Does it get down to kind of that source credibility that you had sort of alluded to? Or is it really the repetition in which we're seeing information? Can you break that
I
down
think
a
that's a
little bit?
very good point, and I believe that both like source credibility and the credibility of the content, the message content itself, both matters. Um, and that's also like a lot of other research has been done already, and then I believe that there are really a lot of interesting areas that we can further develop. So when we say like source credibility, we can think of like who uploaded that information or who shared that information. So, for example, if you have a low
Mm-hmm.
credibility toward a person who uploaded inaccurate information, you may have a suspicious on the credibility of that information as well. So I can say that source credibility and information credibility go hand in hand. But I really have a more focus on the credibility about the nature of information, because as I said it before, in like kind of health crisis situations, we see a lot of like fear-driven information, and that's oftentimes related to the
Mm-hmm.
misinformation. So I was wondering if we just focus on the message content itself, regardless of the person who shared that messages, if the message contains fear and that the message doesn't have like specific evidence, for example, like the quotations from the health experts or other statistical evidence, how the people can believe that, messages, and if they believe, like which factors really matter for them to, believe them messages. So both of the source credibility and message credibility are important to be addressed altogether. Yeah.
So we're going to shift gears just slightly. You've mentioned that your research, you're doing a study about or that integrates COVID-19 and the pandemic, but how has the pandemic affected just your ability to conduct research? What are the biggest challenges, or have there been any bright spots?
Well, I mean, like not only as a researcher, but also as just a person who lives in this, area and then community. I'm kind of really feeling sad about this whole situation, because a lot of people, I see a lot of people, including my cohorts, are kind of exhausted in these days. I mean, this actually, yeah, not only just to do just research, but also to live our normal lives, right?
Yeah.
Yeah, so that's also the most distracting, thing to me as well. I feel like every day is kind of like Groundhog Day to me. Every day is the same. Every morning I walk up the same time and just do my work, just going to the computer. So yeah, I mean those kind of just stressful points really exist these days. And I can say that even though I do a lot of research about the COVID-19, and it actually helps me to develop further idea about the situation, all like kind of managing emotions and the way that I see on social media platforms, like how people have a conversation with others, really affects me a lot as well. I also, as a researcher, I also examine a lot of like social media posts that others upload, and then I still see that people really express their anxiety and hatred feeling toward others, even like about the kind of COVID-19 vaccination issue. So yeah, I'm kind of like feeling some kind of sad and distressed feelings about whenever I just see those kind of social media posts going around.
Yeah.
So how do you get the word out about the work and the research that you do? Basically, how do you kind of promote yourself? I know in some cases, academics are great with self-promotion, and in other cases, less so. So how do you get the word out?
So if you are asking in terms of, some kind of practical tips, like how I can self-promote myself, am I right, Kim? Yeah, I mean,
exactly.
I use some kind of like social media platforms as well to advertise what I'm doing and introduce my recent work. And I also use a lot of how can I say, like my personal website as well. Yeah, those are some kind of main routes that I self-promote. And on the other hand, I also, by doing a lot of like collaborative work with other colleagues, they really brings a great benefit and great synergy to me as well by promoting what others work are, and oftentimes they really cite my work as well and promote my work as well. So that's the point I really appreciated. So it's kind of like win-win game to each other, and I'm really enjoying this academia world.
Do you start your social media posts about your research with, "I'm credible. This is a post you can believe"?
Yeah, that's the fun thing. Yeah, so I can say that I'm kind of about an observer in social media, because I don't post a lot, even though I do a lot of like social media research. I don't post a lot. I mostly observe what other people are saying and just feel like diverse emotions. So yeah, that's something that I can tweak the direction that how I can use my social media platforms further.
So just one final question for you, and hopefully this is a fun one. As academics, we have the very good fortune of being able to travel to different countries and different cities around the United States to present our research and talk to others about our research. What are some of the places, some of the favorite places that you've had a chance to visit to present your work, or some of the places that you're looking forward to?
So I also think that that's very fortunate, and the most memorable places to me was Prague's Czech Republic. Was it 2018? Yeah, for I think.
Yes.
Yeah. So
Yep.
that was actually my first time to visit the European countries, and so I really felt like different kind of vibe in there. So yeah, that's the most memorable trip to me. And the place that I'm looking forward to visit sometimes is actually, you know, if you think about, the upcoming conference, I'm really hoping that we can go to Colorado Boulder in next ICA. So in the meantime, hopefully this pandemic situations really goes down. And I'm also looking forward to go Paris, France one day in the 2 years after ICA.
Yeah.
Yeah, a lot of places that I wanted to go in the next few years.
Yep. Ji Young, it's just been so great getting a chance to talk with you today. Thank you so much for sharing your research with us and with our listeners.
Thank you, Ji Young.
Thank you so much.
It's been really great. Thank you
so much, Kim and Annalise. Yeah.
Bye.
Bye-bye.
All right. Thanks so much for joining us today in our conversation with Dr. Ji Young Lee. It was really fascinating to learn more about this health misinformation that we're often receiving from different media platforms. It certainly makes me pay more attention to this health information I'm getting on social media and the internet. Next week, we're going to be talking about something similar. But if you use a health app, or if you have a fitness watch or anything like that, this conversation is definitely for you. We hope you join us next week. Thanks so much.